Welcome back to the Brilliant Fertility Podcast. Today, we are going to be busting some of the biggest fertility myths. One in particular came across my social media feed this week, and I had to do like some serious grounding and tapping and resourcing to not just absolute go into a state of rage that day. Oh, I can't wait to tell you about that one. But why do we want to bust some of these myths? Because I want you to be able to have a sense of empowerment around your fertility. I want you to get good sleep at night. I don't want you spiraling into rabbit holes of the interwebs or feeding all of your information into Grok only to get back answers that are only 27% accurate. I want you to have accurate information, and I want you to be able to truly live your life from an empowered place while you are actively trying to conceive or allowing your family to grow. So let's dive into it. Some of these fertility myths are ancient. Some are being debunked with research as we speak, and there's a lot of in between there. So when I am dealing with some of these questions with patients, it's funny because we have information at our fingertips 24/7 now. And that's so different from when my generation, when we were growing up, when we were kids, it was like you were waiting for the dial-up internet to load an answer to something. And even then you couldn't guarantee, what that answer was coming from. And nowadays we just have so many opinions available online. We have a ton of studies, but are they actually accurate for our scenario? Are they truly representing what is happening in our individual fertility stories? Not always. And the first and all of these are important. So I don't want to say most important, least important. Like the first one that I'm going to address is this idea that you have to wait a year to see a fertility specialist. So the definition of infertility, of course, is if a couple has been trying to conceive for a year, they've been having unprotected sex for a year, and they haven't conceived yet, then we can say they have infertility. But that doesn't mean you have to wait a full year for a fertility workup or to understand what you could be supporting differently or better. And there are some big opportunities to support people before they get to that point of having waited a year. And I think why that's really important is when someone has already been trying for a year, and especially if they've been told by their medical provider, like, hey, don't really worry about it until you've been trying a year. And then if nothing happens, then we have to dig into it. Then we have to refer you to a specialist. So it's like this very black or white situation where people are kind of like, okay, well, I just won't really stress about it for the year. And then nothing happens. And then it's all of a sudden really discouraging. So we can be a lot more proactive about this and completely change the conversation. I think what's frustrating is that oftentimes if we're waiting for fertility benefits to cover testing related to fertility, we have to wait that year. But if we're asking questions, if we're asking deeper questions about what's been happening in someone's health and in their cycles, it can warrant testing before we ever get to that point of having waited a full year. So if someone's had a history of irregular cycles or autoimmune disease or insulin resistance or type 2 diabetes or metabolic syndrome or PCOS or really painful periods and possible endometriosis, this is enough for me to want to dig into the picture sooner. Honestly, for me, even just someone saying, hey, I'm thinking about getting pregnant next year is enough for me to say, great, let's check some of your labs so that we can be proactive about supporting anything that needs to be supported now. Because a lot of times if we wait until someone is pregnant and then we're like, oh, you're pregnant, let's run a couple things, we're more limited in what we can do about it. And we really just have to jump into interventions. And one example I will give is with thyroid issues. Now, someone can be a state of subclinical hypothyroid for years, and it doesn't actually pop up as true clinical hypothyroid until they get pregnant. And the need for thyroid hormone goes up 30 to 50% in pregnancy. And so if they were already operating at kind of like sluggish thyroid performance for whatever reason, and then they get pregnant, and then immediately their body's like, oh shit, we got to make more thyroid hormone, but we're not really keeping up with this very well. That's a scenario that could potentially put a pregnancy at risk. And I don't say this to fearmonger. I say it because I've seen it in practice. I've had scenarios where women came in, after having an early pregnancy loss, after we scanned their last couple labs and went like, oh, this was possibly a picture where someone was in this subclinical hypothyroid, wasn't really ever addressed because they were like, nah, you're technically in the normal range. But then it was the pregnancy that added an additional stressor. So if we can get ahead of that, that means that we can actually improve outcomes. I can't give guarantees, that's not ethical, but can we improve outcomes? We often can by being proactive. So I do have my fertility lab checklist that I'm so happy to share that I will link in the show notes. And that goes through the majority of the labs that I order with my preconception patients. There are some labs on there that I have another episode about, the functional tests like comprehensive stool testing, Dutch hormone testing. Not everyone needs to have those types of tests. And I think in the world of functional medicine, they are vastly overused. But go back to that episode that we'll link in the notes as well, so you can find it easily to learn more about when and how and why I use those particular tests. But the blood work that I have on the fertility lab checklist is what I do run on most of my preconception clients so that we can be proactive about optimizing their hormone health, lowering their inflammation, balancing their blood sugar. And you don't have to wait a year to do that. That is something that you can be proactive about now. And that tidbit about blood draws is what leads me to this next myth that had me just so utterly outraged that I didn't even know how to function for 20 minutes after seeing this. So this was posted by Anthony Williams, aka the medical medium, last week on probably all his social media, but it came through my Instagram. That was saying the most common reason for miscarriage is getting blood draws in early pregnancy. And I cannot tell you how angry that made me, because we have no evidence for this. And in fact, I can't tell you how many times I have caught something in early pregnancy that we were able to treat ASAP and probably saved that pregnancy, if not that woman's sanity, through the first trimester to know that she was being well supported. So we have no evidence for this. Now, it'd be one thing if someone was donating a pint of blood, right? That might be quite stressful on a body that is actively trying to increase its blood volume. And even from the traditional Chinese medicine standpoint of knowing how the energy of blood is so critical for fertility and early pregnancy. And if someone is rather energetically blood deficient, not truly blood volume deficient, that could be one of the patterns in TCM that contributes to infertility, subfertility, pregnancy loss. But in general, going in for a blood draw where you have a couple vials of blood drawn is not going to make a physiologic impact on a pregnancy. And that's so alarming to know that now hundreds of thousands of people have seen that message and thought, oh shit, did I cause this miscarriage by going to get my blood drawn? Or did my doctor cause this by ordering too many blood draws? It is standard of care in fertility treatments when someone is going through IVF. They will have blood draws throughout early pregnancy. It is standard of care in my practice to do a blood draw. And I also encourage you to tune into your intuition. It's not a black or white scenario, but to say that the most common cause of early pregnancy loss is blood draws is so wildly not okay. What we do know is that the most common cause of early pregnancy loss is genetic factors of the embryo that we had absolutely no control over. And so for any of you who have experienced a pregnancy loss, who have wondered, why? Is there anything that I did wrong? Is there anything I could have done differently? First, my heart is with you. It's so hard to go through that. It's so hard on my end, even as the practitioner, to know that someone is going through that. And also, I am fully on board with doing whatever tests we need to encourage that pregnancy to keep going or to understand what's happening in that pregnancy. It's a very nuanced conversation around pregnancy loss. There are, unfortunately, too few studies on why it happens, especially in recurrent loss, but we do know that the genetic makeup of the embryo is the largest factor. There are some hormonal factors, there's blood clotting factors, and then there's the realm of potential unknowns. But where I tend to focus on wanting to understand is thyroid in a healthy place? Are we producing enough progesterone? Is there any autoimmune component? Is there a potential blood clotting component? What's happening on the male side? Get to that as one of our myths later on. But I'm not worried about blood draws in early pregnancy, okay? It has never even been on my radar. And one of the best books that has been written thus far about pregnancy loss, and especially recurrent pregnancy loss, by Dr. Laura Shaheen, You Are Not Broken, it's such a well-researched book, but it's also such a reassuring book about of the things that we know, here is what we can be doing about this. And I highly encourage anyone who has experienced a pregnancy loss or multiple losses to read that book and check out her podcast as well. Our next one, we'll just segue right into the dudes, because there is still so much pressure put on women and this idea that infertility is a woman's fault. There's the woman's fault. Well, I'm here to tell you, friends, that it takes two to tango. Sperm carry 50% of the DNA of the embryo. So, of course, their genetic contribution could also factor into fertility. And it's so frustrating to me when I have a couple come in, or I have a woman come in, and she has been doing everything, absolutely everything she can. And she has been doing it perfectly, and she is just feeling all of that stress, and she's on the verge of burnout. And we say, has your husband's sperm been tested? And they're like, no, everyone he's really healthy. So everyone just says it's probably fine. But we don't know. We can't know unless we test. And there are some updated guidelines about male factor testing that I want to make sure you guys are aware of today. But also, we cannot know unless we test. And the reality is that male factor contributes to 40 to 60% of cases of infertility. So we can't just assume that it's a woman's fault just because she is the one getting pregnant. The egg is very responsive to the sperm. And so it's kind of fielding for okay, is there a healthy one that I can let in here? And there is absolutely the possibility that the egg is really picky and saying like, none of these are good candidates. None of these are suitable to fertilize. But even then, if it gets past the fertilization point, there are some checkpoints. And because of the sperm DNA contribution, especially if there's high DNA fragmentation, so if there's a high level of damage to the DNA inside the sperm, because that's what the head of the sperm is carrying. It's that DNA all packaged up in there. If there's a high DNA fragmentation, that can also contribute to early pregnancy loss. Yes, I said it. Sperm DNA can contribute to early pregnancy loss. And so not only is infertility not 100% a woman's fault, but miscarriage isn't even necessarily 100% female factor. I want to just also put out there that, like, infertility is no one's fault. I really hate like the blame and the shame that our society has loaded onto this. It just makes it so much harder to talk about for people who are going through it. It makes it so much harder for couples to be able to maintain intimacy in their partnership when blame and shame enter the picture. So let's also just imagine that we could like clean off the whiteboard of all the blame and the shame and say like, hey, we're just humans trying to do the best that we can with the information that we have. And if we could come from that place, how much more free would we be on this journey to find answers and do things differently and stay curious? So knowing that male factor can absolutely be a contributor to the infertility picture, how do we test for that? Well, we want to make sure that we have a complete semen analysis. I do prefer to have couples run that semen analysis through either a reproductive endocrinologist's office or an andrologist. We are so lucky here in Tucson. We have an office called Arizona Andrology. They are just running semen analyses all day long. They have a master's level trained andrologist who goes through those results and checks things off and even like writes up a little report on why they think something might look the way that it does. It's great. Not everyone has access to that. I realize that's really challenging. But that would be my preference if we could go either to the REI's office or an andrology center. Now, I also love when we can get some other labs on our guys. I want to know what's going on with their blood sugar and their hormones and their inflammation and their vitamin D levels. This is all very impactful to the quality of the DNA that you're putting out there. And we have enough information about epigenetics. So this is how, our genes are turned on or off in our lifetime and how that can be passed on through the next several generations. So we know that the diet of the father can change the genetics of the child by turning genes on or off and changing a child's risk for diabetes or obesity. So it's fascinating. And so that also tells us that the male lifestyle matters. I know we need to have just like several episodes about the male factor as well. This is kind of just let's bust these myths, let's get them out of the way so that you can stop having these arguments or staying up all night on a doom spiral or feeding all of your information into AI, which is not usually, it's not always accurate. And, unfortunately, I do have a lot of patients who have, before they've come into my world, fed their whole story into Grok or ChatGPT. And sometimes they're told helpful things and sometimes they're told things that are just like, no, we don't actually have evidence for that. And they made up the source for it even. So be so careful with how you are utilizing AI in your health. I wouldn't feed it any of my sensitive information. That makes me like very nervous from a privacy standpoint and a liability standpoint. But that's just me. You do you. But when in doubt, Get your information from someone who's been doing this for a long time. All right, so this is a good segue into the next piece of this because it also has to do with if we're going to be testing male factor, if we're going to do a semen analysis. We used to give the advice, or some people are still giving this advice, but the most recent data shows that we actually want to have pretty regular ejaculation leading up to a semen analysis for the most accurate results. It used to be they'd say, okay, abstain for 7 days, then do your sample. And the same was true for men who had like lower sperm count, like leading up to the fertile window. They'd say, okay, abstain for at least 7 days and then try to have sex like every 2 days or every other day in the fertile window. And this not only doesn't necessarily yield the best results, but it also puts so much pressure on couples. And so this next myth is that couples have been told, some people have come to me saying that they had been told by a previous physician that they had to have sex every day to increase the chance of pregnancy. And at first they were like, oh, right, this is something that we can control. Let's do this. And after a while, that just starts to feel like a chore. And it can lead to burnout as a couple. It can lead to this place of feeling like sex is just perfunctory. Right? It's just a means to an end. It can diminish the connection, the fun, and that's such a bummer. That's such a heartache, right? You come into this with this sense of optimism and this gets to be an extension of our love for each other. And then it can just start to feel like, we got to do that again. Okay. And what a bummer. So thankfully, the research suggests that we don't have to be so intense about that timing. Not only does it not make much of a difference in sperm quality, but it also means that we get a little bit of a break and we can focus on quality over quantity. So how I typically advise my patients is every other day in the fertile window, but then setting the intention to connect in intimate ways throughout the month. It doesn't always have to be sex. Sex is not the only act of intimacy, but this can be cuddling, this can be snuggling, this can be meditating together, this can be finding other ways of being fully present with each other. And sometimes that will lead to something sexy, but it doesn't have to. There doesn't have to be that pressure around it. And the glory of the fertile window is that we've got 5 or 6 days in there. And you don't have to put all this pressure around the day of ovulation, because I definitely have worked with couples who had that issue of they get the positive OPK, they see that LH surge, and they're like, it's now or never. And there's so much pressure around the next 24 hours that sometimes it can lead to performance issues on the male side. Sometimes that puts so much pressure on the situation that it just doesn't happen at all. And that can leave couples feeling really discouraged, really embarrassed. It's not fair to anyone. And it's human. Please, there is no shame in my space around that. But there's also ways that we can work differently so that there doesn't have to be so much pressure around it. So if you know that you've got this window of 5 to 6 days and that sperm can survive in the female reproductive tract, then this is one of the reasons it's so helpful for me to know what's happening in someone's cycle and for us to use the fertility awareness method as a way of charting the menstrual cycle, not from a place of obsessively data collecting, but just looking at, okay, if we were to find more ease, if we were to time things, then we could look at this and say, okay, on average, this person ovulates on day 16. So we know from about day 10 to 17, if you try to work it in every other day, then we've got a really good shot of timing that fertile window properly. And this leads us to the next myth, which is that everyone ovulates on day 14. This is wildly not accurate. And unfortunately, most of your cycle tracking apps are going to be based on someone who has a 28-day cycle and is ovulating on cycle day 14. But that's only accurate for about 13% of the population. That's not a lot. And you could even have a 28-day cycle, but still, you're not always ovulating on cycle day 14. We got to have other ways of knowing what the body is doing. So you could have someone with a 28-day cycle who ovulates on day 20, and then their period starts 8 days later. Ooh, that gives me so much more information. Or you could have someone with a 28-day cycle who ovulates on cycle day 7. Yes, cycle day 7. So like someone could literally still be on their period and ovulating, and then they get another period 14 days later. And like, which one of those scenarios is better? Interestingly, the person who ovulates on cycle day 7 and still has a 14-day luteal phase, and I know I'm getting like really nitty-gritty into my tracking nerdiness right now, but that scenario has a higher chance of conception than someone who ovulates on cycle day 20 and only has an 8-day luteal phase. And this is where I could nerd out for days on and get really into looking at what my patients' cycles are doing. But I just want you to know that only 13% ovulate on cycle day 14. And then we've got a lot of variability within that. And we mostly have variability in the follicular phase. So from the start of the period until ovulation happens, there's a lot more variability. And then the luteal phase, so from ovulation until your next period, that's where we want to see more uniformity. We want to see that phase 12 to 14 days pretty much in all ovulating folks. So I hope that gives you an idea of what some of the bigger myths are and what is the flip side? What are the truths instead? And how can we navigate this with more clarity and more confidence and more empowerment and hopefully find more ease in your life as a result of it? So just to recap, we covered these myths today, starting with you don't have to wait a year to be worked up for fertility or preconception support. You can actually do that whenever you damn well decide. You may have to shop around, you may have to find the right provider, but there's a lot of us here for you. I am here for you in that if you want to be proactive about your fertility. Number 2, miscarriages are not caused by blood draws. For fuck's sake, they are not. Anthony Williams, no. I can't. Goodness, I think I still need to do some work around that. I'm still triggered. And just to put out there, like I'm deeply a fan of using intuition and connecting with your own intuition. I'm not a fan of outsourcing your intuition to someone else who claims to have an intuition about something. Those are different scenarios and maybe a conversation for a different day. Number 3, infertility is not always a woman's fault. 40 to 60% of the time, there is male factor involvement, and we have to do a proper workup for that. Number 4, you do not have to have sex every single day in order to get pregnant. In fact, it is probably best timed to aim for about every other day in the fertile window. So 5 days leading up to ovulation, all the way to 24 hours after ovulation. So we've got about a 6-day stretch. Number 5, ovulation only happens on day 14 for about 13% of ovulating people. So we've got, a whole 87% of us who aren't ovulating on cycle day 14. And what do we do about that? We need to learn how to use the fertility awareness method to better track someone's cycle and identify their fertile window so that we can take a lot of the pressure off trying to have sex every day or creating all this pressure. And then we also have this opportunity for learning what the body is communicating so that we can be more targeted in our approach and understanding what the body needs to get pregnant and stay pregnant. I hope you learned some really good stuff today. I enjoyed getting into this with you. And I would love for you to just pause for a moment and notice that now we've busted some of these, if there's just a little more spaciousness in your brain. And if there's anything else you're curious about, go ahead and save out those questions for an expert. And if you are ready for deeper support, I'm here for you. We'll drop the link for a discovery call in the show notes. And if you feel ready to dig deeper into your unique fertility journey, you can click that link and book a call with me. And I would be so happy to dive into this with you. All right, I am sending you so much love, as always. Until next time.